Hello and welcome to Emergence Leading from the Field. My name is Artemis Evangelidi and I am your host. This podcast shines a light on courageous leaders from around the world, leaders who are shaping the future in bold and inspiring ways. Moving beyond the boardroom, we feature authentic conversations with guests, the change makers, the visionaries and innovators who are leading from experience, purpose and heart, from the field where transformation takes place. These are conversations with people who are listening deeply, acting boldly, and are doing their part to shape a more conscious and connected world. Our conversations will offer a rare glimpse into how our guests have overcome challenges while spearheading innovations that have enabled them to lead from the front lines. Be inspired as our guests share their journeys. Today, I am absolutely delighted to be joined by Dr. Avi Charlton, GP, speaker, author, and a leading voice in lifestyle medicine. With over 2 decades in clinical practice, she's on a mission to shift healthcare from reactive treatment to proactive transformation. Dr. Avi is the founder of Melbourne Low Carb Clinic and Breathe In Health, where she helps people reverse chronic conditions and improve well-being through nutrition, functional breathing, and lifestyle interventions. Dr. Avi, welcome to the show.
Hello, Artemis. Thank you so much for having me on your podcast.
It's wonderful to have you here. So I'm going to start at the beginning and ask you, what first drew you into medicine?
Yeah, well, I've been a doctor for 25 years, a GP for about 22 of it. I went into medicine straight after I graduated from year 12, and I got the points, and I thought I wanted to do medicine, mainly because I wanted to help people, and I feel like I can get into medicine. So that's mainly it. I wasn't pushed by my parents. A lot of Asian parents wants to have their kids become doctors and lawyers, but that wasn't me. But I really wanted to help people. I got into medical school after my points was enough. And after 6 years, I went into hospital practice. I was an intern. And 20 years later, I'm here now. So a GP, general practitioner.
Wonderful. And when did you start to feel that conventional medicine wasn't giving you the full picture? Because I'm kind of fascinated. There must have been something where, or a moment in time, or a specific patient experience where you thought, hang on, maybe there's something more here.
Yeah, absolutely. So I started off as a normal GP. I just prescribe blood pressure tablets, diabetes tablets, antidepressants, and just like normal GP. So about maybe 7 or 8 years ago, I felt a bit tired, chubby, and my kids was probably 5 and 2, something like that. And I felt that I needed to lose weight. So what happened was one day at a clinic, I was busy. A patient noticed that I was a bit chubby and tired, and I was writing a prescription. So she asked me, "Oh, are you having another baby? Are you having a third baby?" And I thought, "Oh my God, I wasn't. I was just a bit tired and chubby and a bit overweight." And I thought to myself, I can't be an overweight doctor. It doesn't look good on me. I needed to lose weight. So I was adamant that I need to do something about my own health. I need to take charge of my own health. So I went into the local gym and started to work out and join the gym. And the gym prescribed me with a diet because I joined an 8-week body transformation challenge. So this 8-week body transformation challenge, I had to eat so much protein. I had to put food on the scale, 120 gram of protein, 20 gram of carbs, 30 gram of fat. So after 8 weeks, I actually won the body transformation challenge and a few, lost a bit of weight, got into my goal weight, and I was so happy that I can lose weight. And I felt better. My brain worked better. My tummy was less bloated, much more energy, and I started running. So I was so happy, and I started to look into the science of how this happens. My boss questioned me, "Oh, how'd you lose all that weight?" Because he was struggling with weight for maybe 20, 30 years. And he asked if I went into when I he asked if I was doing keto. And I looked into the science of low carb and ketogenic diets, and I was fascinated that no one has taught us in medical school how we can just switch our body fuel system from burning glucose to burning fat. So I used to say to my patients, if you want to lose weight, you just have to eat less, move more. But now, for the last 7 or 8 years, I've discovered that eat less, move more, calorie in, calorie out. This model just doesn't work because if you eat less, move more, you just get hungry and then you end up eating more and you're starved and it affects your mental health. Whereas if you eat better foods and eat good foods in terms of eating lots of protein, lots of healthy fats, and don't eat the glucose and don't eat your carbs, you can actually teach your body to not burn glucose and carbs and teach your body to burn fat. So I started learning about low carb, ketogenic diets, and then opened me up to it's not just your diet, it's your lifestyle as well. It's also all the other things that you do apart from your diet, such as exercise, movement, strength training, optimizing your sleep, stress management, and community support. And some people have addictions, so managing addictions is very important. So it opened me up to all these lifestyle things and not just learning about nutrition. So I've had an amazing journey learning about not just prescribing medication, but prescribing lifestyle and teaching patients to optimize lifestyle so that they can just take charge of their own health and not just rely on medications to just treat a symptom because medication maybe bring their blood pressure down a couple of points, whereas teaching them to eat better, move more, and optimizing sleep, manage their stress, they can manage their metabolic health and make them body work better, more energy, less bloated, less hungry.
Yeah, it's amazing. So there's two things I want to ask you from, well, there's lots of things, but the first two things, I'm curious, why do you think that this wasn't really focused on in medical school? And, I mean, I've spoken with people who have come out of medical school, even more recently. I mean, you and I are, I'm going to guess the same age. We both studied, over 20 years ago. But,
Yes.
even fresh graduates are coming out and they are not trained in this crucial area of health and well-being and maintenance. Why do you think that is? Is it a time
Yeah.
issue or is it something else?
It is very disappointing that we're never taught about lifestyle medicine. There are a branch of lifestyle medicine college that's just starting out, like the James Cook University have started to promote lifestyle medicine as a diploma or bachelor. But back in medical school, I think the focus is on medicine, prescribing medicine, and reactive to symptoms. So we're taught to prescribe blood pressure tablets. We're taught to handle emergencies like heart attacks and give medication to open up arteries if there's heart attacks or strokes. So the focus was never on nutrition and what lifestyle you can do. I think it's a bit of a time factor, and also the drug companies might have got into medical school training and started to talk about evidence of drugs and this and medications. So it is certainly very disappointing. The number of hours that we've been taught nutrition is just maybe 1 or 2 hours in the whole of 6 years medical school, which is really not enough. And it took me a whole lot more hours in the last few years of my 20-year career to learn about lifestyle and nutrition.
Hmm. Yeah, it's really interesting. It
Mm.
leads me to my next question. What do you think, in your opinion, is fundamentally broken in how we're approaching healthcare today? I've heard you say a number of times already, we're focusing on the symptoms, we're trying to medicate the
Mm,
symptoms. Is it
yes.
because we think that people will not stick to a regimen of a lifestyle change? And it's kind of like, well, we need to make sure that we're controlling or, controlling for what's happening, or is it something else? Because, we all know that if you just stick a band-aid on it, but you don't give, you don't treat the cut, for example, if you need stitches, a band-aid isn't going to cover it, right? So I'm
Mm.
curious, what do you think is fundamentally broken in our healthcare system today?
Yeah, I think there's a combination of things. Again, the doctors weren't taught about lifestyle. They've never been taught about nutrition, and they don't, it takes a lot of time to talk about lifestyle and nutrition. So in a quick in and out consultation, 10 minutes to 15 minutes, there's just not enough time to talk about nutrition and optimizing your sleep and stress management. And then the politicians is trying to get every doctors to do Medicare bulk billing, which encourages doctors to have quick 10-minute consultations. So that's one factor. So we've never been taught and we want quick consultations. And a lot of doctors also don't believe it is sustainable, that we don't believe that patients can do it, which is, if you don't talk about it, how do you know the patients can't do it? So I think the patients need to be given that option that these are the options. I think sometimes the doctors can't do it themselves because they are time poor and they don't want to look into their own nutrition and lifestyle. They are too busy to think about their own nutrition. They can't give up their yummy, sugary, carby foods themselves. So they think their patients can't do it. They don't want to talk about it. They're time poor and we are taught about medications. We just want to give them quick fixes. If there's hypertension, we give them blood pressure tablets. And again, that's treating just symptoms to lower the numbers. So there's a number of factors which I am trying to encourage my colleagues to think about. And sometimes I put into GP forums on Facebook groups that promoting low carb is really rewarding, promoting lifestyle. Patients take it up, and it's so much better than giving them a pill for, say, hypertension or depression, anxiety.
Hmm. It's almost as though the systems become so reactive, and here we're really talking about a
Mm,
preventative healthcare approach. I
absolutely.
know that you have focused quite greatly on reversing chronic conditions, which is still a pretty radical idea to many people. Um,
Yes.
and I myself have reversed a chronic condition by going low carb and changing
Yes.
my lifestyle. What do you think is the biggest misconception around what's reversible and what's not? Because I know that, if we look at this holistically, we're not just looking at what you eat and, how much you move. We're also looking at how well do you sleep? What inputs are you,
Mm,
bringing into your sphere of influence? What are you watching? What are you reading? What are your stress levels like? How regulated is your nervous system? All of these things play such a huge role
mm,
on our
yes.
well-being. And I have found in conversations with many people, as I teach mindfulness. So in my mindfulness teachings, I've found a lot of misconceptions around the impact of a regulated nervous system, the impact of getting a good night's sleep, the impact of not watching or being on your phone or scrolling or all those types of things on how you
Mm,
feel and how you show up each day, and then how your body
mhm.
reacts to that. As a doctor, as someone who is focusing on reversing chronic conditions, what do people just don't believe you, or what's going on out there? Why aren't people really, putting their hand up to say this is amazing, sign me up?
Mm, yeah, yeah. I think lifestyle changes are difficult itself because people are so used to their habits and they are used to their own habits and their own things that they do. So doing something different takes them effort to change their lifestyle. And sometimes they change a little bit and then their old habits come in, and it is a difficult thing. And then the modern society doesn't help them because the whole society is high carbohydrate, convenience, and we buy all the yummy food, and then there's sugar, there's processed foods, there's takeaway, instant gratification, and then there's phones and notification, which doesn't help with stress levels. And busy lifestyle, people will have kids, they drop off and pick up. They've got so much things going on. And sometimes they change their lifestyle for a short period of time and then their whole old habits kick in again. And it is difficult. Sometimes I do show them when they change their lifestyle, they lose a few kilos and old habits kick in and then they go off rail. But they know that they can get back on track. They've done it before, and they do come back and want me to help them to get back on track. Sometimes it's a matter of accountability and coaching and helping them to believe that they can do it. Some people need some small steps that they just need to change one habit in a week and slowly get back on track. Some people just need to be reminded constantly with social media posts, and they say, "Oh, it really helps me with your social media posts that I'm constantly reminding them small steps. You just gotta change your breakfast. If you get lost in your diet and if you have a high carb meal, you just have to get back on track the next day. It doesn't matter. You just got to rule a line and get back on track. It's not a big deal. Practice self-compassion. Don't beat yourself up." So sometimes there's just need a bit of extra help because there's so much things that can get you off track, and it's convenience, it's instant gratification.
Yeah, absolutely. I love that you said self-compassion and, not to beat yourself up. But it's okay. You might miss the mark for one meal. It doesn't mean that you
Mm,
can't make up for it with the next one, for example. Um,
that's
I
right.
absolutely love that your work extends beyond food into something as fundamental as breathing. So
Mm.
how does the way that we breathe impact chronic disease and overall well-being?
Yeah, absolutely. So, breathing, if you breathe the wrong way, that can stimulate your nervous system and doesn't help you regulate your nervous system. And with again, the society is so much stress, on the go gratifications, notifications on the phone, busy lifestyle. We really have to remind ourselves to slow down. And we can use breathing to slow our nervous system down. And I teach people to do breathing exercises even when you're not stressed. So I teach people to do 5 minutes once a day would be awesome. 5 minutes twice a day would be even better. 5 minutes three times a day would be even better. Even when you're not stressed, then if you practice when you're not stressed, then when you are stressed, you can just take it out and dig it out. Just practice slowing down your breathing. So there's this coherent breathing, which is very easy. You just do breathe in for 5 counts and out for 5 counts. You can do it anytime you need it. When you have an anxiety attack or stressful situation, you can dig it out and slow down your breathing in for 5, out for 5. That helps your body regulate your nervous system, slow down your heart, increase your parasympathetic nervous system. So you can reduce the sympathetic drive, which is the fight flight response that your nervous system is on the go all the time. Then you can just use it anytime you need it. So that's what I teach people to just dig out your breathing. And it's so easy. You can have it anytime. You can practice it when you're driving. I practice it first thing in the morning when I wake up with a hot drink. And when I've got an upset situation that I became emotional or crying, I can just listen to my breathing and slow down, tell myself to be breathing in for 5, out for 5. And there's so many other breathing exercises that you can do to help you regulate your nervous system.
It's wonderful. And I'm sure our listeners are probably paying attention to their breath as they listen to you speak, which is what usually happens. Someone starts talking about, conscious breathing and everyone goes, "Oh, hang on, I'm not breathing. I need to pay attention
Yeah.
to my breath." What can you give us a little bit of, I guess, your own scientific knowledge around the impact of a dysregulated nervous system in chronic conditions and in chronic illness?
Yeah, so when we are on the go all the time, our body releases cortisol. Cortisol is the fight flight hormone that your body releases normally. So back in the olden days, when in the hunter-gatherer lifestyle, when we're chased by the lion or the animal, then we release cortisol and get us running. But in the modern lifestyle, we are busy and we're on the running around all the time. So if we have high cortisol all the time, this increases blood glucose and we are difficult to regulate our blood glucose. Also, it increases our risk of so higher stress hormones increases blood glucose. We've got higher chance of diabetes, metabolic dysfunction. Our little mitochondria in the cell can't function as well. And this increases the risk of chronic diseases, diabetes, prediabetes, metabolic syndrome, even cancer. So cancer also feeds on glucose and cortisol. So there's a whole lot of chronic diseases and even depression, anxiety, addiction disorders, alcoholism that can increase when you have high stress, high cortisol. So learning how to reduce your stress, slowing down your nervous system, regulating it, can do a whole lot to reduce your chance of chronic diseases such as mental health conditions, metabolic conditions like diabetes.
I hear you say that, and what comes up immediately for me is that you're really about empowering people to take ownership of their health. So moving
Mm,
from this environment of dependency into empowerment and
yes.
owning, how we show up, how we feel, what impact it has on our own health to be able
Mm,
to do that. I think that that's just wonderful, and I can also imagine that that takes quite a shift in the relationship or the traditional relationship between doctor and patient, because
mm,
as you said before, you as doctors, you're all pressed for time. You're supposed to allow 10 minutes for a to see each patient. How can you possibly ask the questions you need to ask in 10 minutes? If
mm,
someone presents with some kind of chronic illness, you want
mhm.
to be able to sit and ask them, well, what's going on at home? Is there a stressful situation at work? What's transpired to bring you to this place? And yeah, it really changes the narrative, doesn't it, when you're empowering people to look after their own health this way. I
Yeah.
feel that what you're doing is building a movement.
I'm hoping so. Yeah. So sometimes patients come in and they want something quick fix. They want an antidepressant for mental health disorders. They want to see a psychologist. They rely on psychologists to talk to them about talk therapy. So certainly those have got a place to help with mental health conditions. Certainly a lot of patients need antidepressants and psychologists. But there are lots of other things if we empower them to pick better foods like more protein and healthy fats and less sugar and carbohydrates and processed foods. Just doing that, that can improve your mental health. Going for sunlight, getting outside, going for walks, practicing mindfulness, looking at birds and trees rather than thinking about dwelling on what's happened to them and feeling sorry for themselves. Just even mindfulness can help them with improving their mental health. And then if they optimize their sleep, regular sleep hours, getting up same time every morning and getting outside first thing in the morning. All those little things can contribute to better mental health and not just relying on antidepressants and psychological talk therapy. So
Yeah.
absolutely, I think I'm help trying to build a movement on prescribing lifestyle, which I always like to say, rather than prescribing medication by itself.
Mm. Yeah, it's wonderful. And there's such a huge movement now. I've been following what's been going on in the US and a lot of the research around highly processed and ultra processed foods and all the additives
Mm,
that are in these these um these things that they call food that really aren't food. There's no nutritional value in them at all, and the impact that they have on children in their, I've been following some research that's been happening around ADHD and, the
yeah.
impact of all these chemicals and these colorings and flavorings and so forth in the food. And this movement it's happening, it's there.
Mm,
There's
yes.
research now to really strengthen the arguments around prescribing lifestyle as opposed to taking a pill to deal with a symptom. As someone who has been in the forefront of this, because you have been and you are such a championing voice, and a public voice in Australia, and really your thought leadership is admirable. What's been challenging for you? Have you found any resistance from your own colleagues, or has it been okay as you've put it out there? What's happened for you in this space?
Yeah, it has been challenging. For example, I have um, on a Facebook post, I have put out, someone asked about some gut disorder and leaky gut. And I put a comment about leaky gut can be improved by real food, avoid processed foods, avoid sugars. And other GPs often say this is not sustainable, can't do it, it's woo-woo. And someone said I might as well get tarot cards out and do and
Wow.
become a naturopath rather than a doctor. So I
Wow.
have had resistance with other GPs just through Facebook posts that I don't even know that doctor who commented.
Mm,
So there is some resistance, and but overall there has been other GPs who's supportive and said they do prescribe similar things about talking about
mm,
lifestyle. But
mm.
again, the doctors haven't been educated about lifestyle. So it is quite disappointing that we've never been taught in medical school about how to promote it. Mm,
I mean, it boggles the mind for those of us who aren't doctors, but who are on a holistic path in whichever way. For me, it is absolutely fascinating that this stuff isn't mainstream and spoken about in terms of holistic healing. I mean, even when I did my psychology degrees, there was, we did a tiny little subset on, First Nations, First Nations treatment and approaches where
mhm,
spirituality and nature and relationships and all of
mhm.
these things are taken into consideration, and I kind of find myself putting my hand up saying, hang on, why is that only taken into consideration for our First Nations people? Like, there's a lot of us who would say that should be taken into consideration for every single human being. There's
Yeah.
so much research around loneliness and relationships. There's so much research around the impact of nature, just being in nature, just
Yes.
being, surrounded by trees. I know in Japan they have forest bathing. It's
Mm,
prescribed. You go into the forest and you sit there to regulate your nervous system. We
yeah.
have the research. It feels as though we're being selective in the application of it, which I find quite interesting. So it's definitely, I think that there's a big push now for people like yourselves to
Hmm.
really be standing in the forefront of this.
Mm,
And the fact that you say prescribing lifestyle, which I absolutely love, is,
hmm.
again, I feel like it's putting the ability back into patients' hands to
Mm,
step up and take control of their lives, not be reliant on, a magic wand to solve things, when actually what you have to do is step back into your own role as looking after yourself, looking after your body and what you what you put in there and what you put out there, yeah, it's very interesting. I have
Yeah.
hope that things will start to shift with the advocacy that, you're doing and that other doctors are doing around the world. I have hope
Yeah,
that
hope
things will
so.
shift. Yeah.
Absolutely hope so.
So,
Trying to spread the word, yes.
absolutely. Tell us a little bit about your book, because you have a fantastic book that you've written. Well, what
Yeah.
can people expect to find in there?
Yeah, so I have two books. The first one is Low Carb Made Easy, which is a very practical book. It's got some graphics on why carbohydrates become sugar and our body can only hold 1 teaspoon of sugar at a time, and a bit of science about the hormone called insulin, how insulin stores the glucose and make it become fat. So there's a bit of science, there's a couple of weeks of meal plan because people wonder, "Well, how do you do low carb?" And there's a few easy recipes on what I cook for my family. So that's the first book, just a very quick book on low carb made easy. Then last year I wrote the second book called Prescribing Lifestyle, which has become Amazon bestseller. I'm very proud. And I've just released the
Congratulations.
Audible and Spotify audiobook version just in the last few days. So that one
Wonderful.
talks about the 6 pillars of lifestyle. The 6 pillars is nutrition, movement, sleep management, stress management, community support, and understanding addictions. So I believe these 6 pillars can help you with managing your lifestyle, and they all intertwine with each other. So if you eat better, you can sleep better. If you move more, you can eat better, then you can sleep better. The community can help you move, and it's all interconnected. Working on one pillar can help you work on the other pillars. So I love all this trying to get people to look into lifestyle. And I'm not saying reading my book can really turn your health right around, but that might help you look into each of the topic and open up to a new rabbit hole.
Amazing. Amazing. Well, I highly recommend that our listeners go out and get your book, because I think that understanding those 6 pillars and how they work together is vital for taking back control of your own health and your own well-being.
Mm.
Um, as usual, we're running out of time. We could keep talking for far longer. But if I was to ask you to leave our listeners with what's the one shift that they could do? What's the one shift that they could do today? The simplest or the easiest shift that they could do today after listening to you, that would have, an incredible impact in the way that they feel. What would you recommend?
I think just keep learning and be curious. So don't just get a set mind that you can't change, but be curious that maybe you can learn, maybe you can change one thing at a time, and maybe you keep looking and dig into a new rabbit hole. Maybe you can learn to change a little bit at a time, change one meal at a time, and then maybe you can cut down a bit of sugar and carbohydrates. Some people think I like bread so much I can't change, but be curious, maybe you can. So maybe you can just shift a little bit and start learning and looking into different podcasts, different YouTube channels, and look into my book. Maybe it's not set for you. Maybe you're not doomed to have diabetes. Maybe you can lose some weight and reverse your chronic condition. So be curious is my tip on how they can take charge of their own health.
I absolutely love that. Curiosity. What a wonderful pillar to start with. Dr. Avi, this has been such an incredibly powerful conversation, and I really want to thank you for the work that you're doing and for being such a trailblazer out there. I'm sure our listeners will be like, "Oh my goodness, I wish my doctor was was like that. Who really cared about my well-being and was empowering me to look after myself." So, thank you for joining us on Emergence Leading from the Field, and thank you for all the work that you do.
Thank you, Artemis. Thank you so much for having me on your podcast. I love your message of leaders and sharing all the message.
Thanks, Dr. Avi. Thank you.